that goes on employees. And I think it's very important. So they get basically.
Hello, this is Dr. Marsh at the Indiana State Board of Animal Health. We'll get started in just a moment. For those of you on the webinar, we have a webinar housekeeping screen up that gives some specific directions with regard to the audio portion of this. So we encourage you to use your computer's audio when possible. And when you're using your computer audio, then don't use your phone for audio so that we don't get reverb on the system. So if you're seeing that webinar housekeeping slide, if you'll follow those instructions, we'll get started in just a moment. Hello, this is Dr. Marsh at the Board of Animal Health. We're continuing to get several callers joining the call or the webinar, so we'll hold for just a moment to give everyone an opportunity to join. So please stay with us. Well, good afternoon to you all. This is Dr. Marsh at the Indiana State Board of Animal Health, and I really appreciate all of you joining the call and webinar today, co-hosted by the Board of Animal Health and the Indiana State Department of Agriculture, with a specific discussion on coronavirus, otherwise known as COVID-19. We did have some webinar instructions up as you joined the call, and so if you'll follow those with regard to utilizing the audio on your computer, or if you're also listening by phone, to mute your computer so you don't have two competing audios on your end. Otherwise, we'll have reverb on our end. So again, we thank you very much for joining the call, and we'll get to the specifics here right away. I'm going to turn the call over to our director of the Indiana State Department of Agriculture, Director Bruce Kettler. Bruce, please.
Thank you, Dr. Marsh, and I also want to add my thanks to all of you on the call. In these very serious times, it's important to know that our agriculture sector will work together, and I just want to thank all of you for the information that has been shared with us and other sources. I think that's it's critical to do so. It's certainly helpful from a state government perspective and being able to share. So thanks for doing that, and you're going to see a lot of specifics. As we move forward, I want to introduce Lieutenant Governor Suzanne Crouch. She is asked to be on the call, and I just want to say she is, as all of you I think know, has been a great advocate for the great industry of agriculture in Indiana. And I can tell you, in the last several weeks, especially, she's just been extremely helpful. She and her team are constantly asking what they can do to help for those of us in the agriculture industry. And so at this time, I'm going to introduce her. I know she has to jump off after her comments, but Lieutenant Governor Crouch, thank you for what you do, and we'll turn it to you.
Lieutenant Governor Crouch, you may have to unmute your line. I want to make sure you can access everyone. If you're by phone, it's *6.
Dr. Marsh said she did *6. I don't know if anybody else is hearing anything.
Very good.
They said to go ahead and move forward. She can hear us, but I don't think we can hear on her. They said to go ahead and move forward. So if we get her back, we'll work her in when we can. Thank you.
Dr. Kettler, can you hear me now?
I've got you, Dr. Marsh.
Okay, very good. Well, I apologize for the confusion, and to Lieutenant Governor Crouch, we will work you in as we can. I apologize for the challenge on our phone system here. We'll go ahead with the Board of Animal Health portion of the presentation today, and I just want everyone on the call to know that the information that we're presenting today is being recorded and will be available on our website. We will feature some specific online opportunities for you, and they'll all be available so you can reach back to those at your leisure, and also therefore can share it with others. We wanted to start with just some fast facts about this COVID-19. It is a coronavirus, and as you can see on the slide, coronaviruses cause diseases in many mammals and birds that have been recognized in veterinary medicine since the early 1930s. So coronaviruses are not new, and particularly those of you in the animal agriculture world and the veterinary community know that we've been dealing with coronaviruses for a long time. We have seven known strains of coronaviruses that affect humans, And so it's not unusual to have it in humans either, although this COVID-19, as it's being called, is a new strain that was discovered last year and had previously not been diagnosed or identified in humans. So that's the reason for this change. It is a strain similar to some that we've seen in the past, including SARS, but it is unique, and that's why we're going through the specific and unique procedures that we are today. As you can also see on the slide, COVID-19 is suspected to have its origin from bats, as has been the case with some other coronaviruses identified in humans over the last few years. I think it's important also to recognize, and the Board of Animal Health has on their website some guidance with regard to pet owners, specifically saying that we have not any information with regard to pets. We have no information that suggests that they can become ill or evidence of spread amongst pets. And so I think it's also important to remember we have no evidence of a food safety challenge associated with this COVID-19. So it's early in the process. It is a novel virus. We're learning more about it. That information may change, but we're sharing the most current information that we have, and that is currently available on our website. Some information at the national level, as you see on the slide from the White House. This was presented by President Trump and his team from the President's Coronavirus Guidelines for America, produced on May of this week. And this two-page document, pardon me, if you're interested, you can see the QR code in the lower left-hand corner. For those of you who are not familiar with QR codes, if you take your smartphone's photo opportunity and hover over that, it will bring up the link to this specific information. It's also available on our website. But importantly for this particular group, the White House information released on Monday says that if you work in a critical infrastructure industry, as defined by the U.S. Department of Homeland Security, such as healthcare services and pharmaceutical, and specifically for us, and food supply, you have a special responsibility to maintain your normal work schedule. You and your employees should follow CDC guidance to protect your health at work. And so I think it's important that we started a conversation here today, particularly for us in agriculture and the agriculture industry, that it is considered one of the critical infrastructures of the United States. In addition to that, just released yesterday by the U.S. Department of Homeland Security's Cybersecurity and Infrasecurity Agency is a document that includes this particular slide that shows the critical infrastructures of the United States and the workers, therefore, that would be in those critical infrastructures. There are 16 of them, and you can see it's kind of in the lower right there as food and agriculture. So food and agriculture are considered one of the 16 critical infrastructures of the United States. Again, this document was just signed by the director of CISA, agency of the Department of Homeland Security, just yesterday. Critically important, again, I believe, for us in the agriculture sector. In addition to that slide that showed those 16 critical infrastructures, in that document, you will find where food and agriculture is detailed further. We have pulled out only 3 of several bullet points, and I would encourage you to either hover over that QR code or take a look at our website, because this is on our website to go directly to the link. But you can see there some of the workers and employees in these critical infrastructure areas, specifically as we've listed here, food manufacturing employees and their supplier employees, farm workers, which include farm and fishery labor needed to produce our food supplied domestically, animal agriculture workers to include those employed in veterinary health. Therefore, we consider veterinary clinics and veterinary practices under this as part of the critical infrastructure for Indiana and the United States. Transportation of deceased animals for disposal, raising of animals for food, animal production operations, slaughter and packing plants and associated regulatory and government workforce. So again, this all comes from that document just signed yesterday by this Cybersecurity and Infrastructure Security Agency, which I think gives us good direction on our identification as a critical infrastructure of the United States. On the next slide, we've gone to information from the CDC as it relates to critical infrastructure personnel. You can see here on this slide, this is lifted from a CDC document. Again, your QR code is in the lower left corner, or if you like, you can go to our website and this document is listed there. It is by title, the Interim U.S. Guidance for Risk Assessment and Public Health Management of Persons with Potential Exposure. We have lifted from that document a couple of bullet points. Again, there's more information on that link, but there are two links. There are, on that link then, there is a good bit of information. We have pulled out two specific sites that I think are germane to our particular industries. If you'll please mute on your. Okay, very good. We'll start again. This information that you have on the slide is specific to a CDC document, and this particular document speaks to personnel in these critical infrastructure positions. We have lifted just two bullet points from that document. There's more information there. If you again go to the QR code in the lower left-hand corner or to our website, you can get this detailed document. I'll dive into this further. The two bullets that you have in front of you, you can read for yourself, but I think they're particularly germane to our work. Personnel may be permitted to continue work following potential exposure. This SARS-CoV-2 is otherwise known as COVID-19. That exposure either taking place from travel associated or close contact to a confirmed case. They may be provided that they remain asymptomatic. Additionally, personnel who are permitted to work following an exposure should self-monitor under the supervision of their employer's occupational health program, including taking their temperature before each work shift to ensure they remain afebrile. Now, this CDC recommendation and guidance with regard to critical infrastructure positions, I have offered back to our State Department of Health so they can evaluate it with regard to the infrastructure document that we just spoke about from the U.S. Department of Homeland Security. The reason is that this particular piece has been referred to only to the healthcare community, and we want to make sure that those recommendations are valid and can be branched out to be utilized for critical infrastructure positions, including those in food and agriculture. The next slide of the set is one from the State Department of Health. State Department of Health, of course, is the lead agency for public health here in the state. This is just a screenshot of their website. And again, the QR code is in the lower left-hand corner. The information that I'll be presenting next is available from the State Department of Health website. And so therefore, you can go to that website to keep current on information with regard to public health at the state level. For example, this slide is available on that website, updated each day at 10 a.m. in the morning with the latest information with regard to cases identified in our state. As you can see on the map on the left-hand side, they are identified by county of residence, and you can see the number of cases in each of those counties. To the right-hand side, you can see the total positive cases we have in the state, and these positive tests reflect results from the State Department of Health and results submitted by private laboratories. Unfortunately, as you can see on the slide, we have had 2 deaths associated with COVID-19 in Indiana of the 554 people who have been tested to date. So again, on this site, you can keep current on what those numbers are. Not only at the state level, but at the national level, we are being advised to be prepared for a significant change in these numbers because of increased testing taking place in our human population. So don't be particularly alarmed because there's been a backlog of testing, so we may see quite a surge over the next few days. The next slide is the State Department of Health's Epidemiology Resource Center. This line and this phone line, as well as the email opportunity, is offered 24/7 to our citizens. You can see the 877 number. It is being staffed by folks at the State Department of Health, and frankly, they've reached out to broaden their capacity to answer the number of questions that are coming in from our citizens from across the state. The information, again, that I have just provided for you comes from the State Department of Health website, and that is available directly from our website at the Board of Animal Health. The next slide is one that you likely have seen, but it is the one that's referred to as flattening the curve. And this is indeed what we're trying to accomplish, not only in the United States, but in countries around the world. As you can see on the x-axis, we have the time since the first case. On the y-axis are the number of cases. And you can see, therefore, the dotted line, the healthcare system capability. And we're trying to suppress this and flatten this curve so that we don't end up with the red curve without protective measures where we have a very high number of cases in a rather short period of time that would outstrip the capability of our healthcare system. And by putting the procedures in place that are becoming widely used, the hope is to suppress that number of cases. Although we may have them over a longer period of time, the goal is to make sure that we have the healthcare capacity to cover them. Coinciding with this, of course, are all the recommendations we are hearing. The ones I'll give you are 5 quick ones that come directly from the CDC website that I hope you're all aware of. These are all measures that are being discussed with regard to flattening the curve. Number 1, clean your hands and wash your hands often. Number 2, avoid close contacts. Number 3, stay home if you are sick. Number 4, cover coughs and sneezes. And number 5, clean and disinfect frequently touched surfaces. So there's additional information on the CDC website that we'll give you in a moment. But again, the flattening the curve is the justification for all the measures that you're seeing out across our country. The next slide is the CDC's website for coronavirus. We have found this to be a helpful website to us here at the Board of Animal Health and have shared it. You can see in the yellow bar there, the President's Coronavirus Guidelines for America. There is that whitehouse.gov website where you can go and get information directly. And that was the first piece that we presented today. Additionally, you can see the How to Protect Yourself. And if you think you are sick website options, and those have good information behind those, and that's why we're offering those to you here today. The next slide shows you one that has also been very helpful to us, and I think it will be to you and the business community as you continue to deal with the challenges of this COVID-19 pandemic. This one speaks particularly to interim guidance for businesses and employers. And as you drill down into this information, that's where we found the information, for example, of how to manage personnel in critical infrastructure situations. A great deal of information there. And again, in our attempt here today is to give you some of the key ones that we think have been particularly helpful to us. We recognize that there is a crush of information. And so on the next slide, we've tried to distill this down to 4 sites. 4 sites in particular, and I know there's lots of other information out there, but these 4 sites are linked directly from our Board of Animal Health website. So rather than go into all 4 of those, you can come to ours to get that information. We have divided these into 4 categories. The first category is national public health, and that's the CDC and the information and in part what we provided here today. The second one is state public health, and that's the website to our State Department of Health. The third one are animals and the veterinary community, and that's the AVMA. Even for those of you who are not veterinarians, there's good information on the AVMA website, so not only for veterinary community, but for animals in particular, good information on animals and veterinary interests at the AVMA. The fourth one is animal products. And I know some of you deal with USDA's FSIS, et cetera. We found the FDA site, and of course, those of you in the dairy industry deal with the FDA. This website is good, gives a good Q&A with regard to what to do in your plants and facilities with regard to employees. Those, again, are all linked to this Board of Animal Health website. We want to make sure that you have direct information to our agency, whether it's email, website, or this phone number. And I want to reiterate to the group here today, the Board of Animal Health is open for business. We want to make sure that our customers in the agriculture community and food and agriculture understand that we are open for business. We look a little differently in the office than what we did before, in that several are working from home. We've equipped them in order to get the information and the technology they need to work from home. So I appreciate very much, and I'm proud of my team here at the Board of Animal Health. And so that has helped us continue to provide service to our customers out across the state. We believe, as you believe, this is a critical infrastructure of the United States, and therefore we're here to serve you. We recognize we have a priority to protect the health of our employees, as you are doing in your businesses out across the state. And again, we are trying to do this as seamlessly as possible as we continue to provide service to you. I think the other thing that I want to make sure is understood, and we've had some inquiries, and we'll open this up in the end after Director Kettler gives his remarks. But I want to make sure that people understand that the Board of Animal Health, and nor have I heard this from state veterinarians across the country, there are no restrictions for animal movements, et cetera, in order to move products and animals in interstate commerce. We have not waived the requirements for certificates of veterinary inspection and other tests as required for interstate movement, but nonetheless, we do have no restrictions in place. We've had inquiries about moving various animals across state lines, and there are no restrictions. As Director Kettler mentioned at the outset, we're grateful for your participation in this webinar and call today. These are unprecedented times for all of us, and we recognize that this information is rapidly changing. As a matter of fact, this morning, this slide set was changed within the last hour as information becomes available. But I'm quite confident with the sectors that we serve, and we're committed to continue to serve, that regardless of the challenges that we're met with this virus, we've kind of been thrown a curveball by Mother Nature. We will prevail. We will find a way with our ingenuity and professionalism to find a way to prevail through this challenge as well. So I appreciate your attention, and I'll turn it back to Director Kettler.
Thank you, Dr. Marsh. Certainly appreciate it. Always good to have a lot of good folks in our industry, and I think that's one of the things that allows me to remain hopeful that we've got people in all of our sectors doing this work. My first comment, I also want to reiterate what Dr. Marsh just mentioned from a State Department of Agriculture perspective. All of our employees are working, albeit at this point, of course, a lot of telework going on, but we have everybody fully functioning and available. So if there's anything that any of us can do on our entire team, I hope that you will reach out. I would also say I know that a number of you have, and one of the things that I wanted to mention was just that. I think communication is key through all of this among all of us, whether that's from a business, from a number of the commodity and livestock groups, the ag business folks. This is it's really important. We know that this is probably going to take a while, going to be ongoing for a number of weeks, maybe months. And I think it's really critical that we all continue to communicate anything that you can. I would say more specifics that you have, the better. That allows us to be able to continue to feed information to the appropriate sources as we go. Since we didn't get to hear the Lieutenant Governor, I just talked to her earlier this morning, and I know what she was going to share with the group. So I'm going to take the liberty, if I might, be able to do that right now, because I think it is it's critical that you all know and understand. The first thing is when it comes to critical infrastructure, which is where I think most of us have kind of centered around and making sure that that is done. I want to assure you that the governor and the governor's team and the people that are making those decisions, including the lieutenant governor, that information has been shared. The lieutenant governor has specifically provided it to those folks. I can't tell you at this time when an announcement specifically will come, but I feel very confident, as does the lieutenant governor, that we will have specifics from the governor's office and on a state level about reinforcing and reassuring everybody that ag and food is a critical infrastructure in the state of Indiana. I have shared with her and with those folks that we think it is important that this be done very quickly, very soon, at the state level, so that we don't get a patchwork of local issues. There will be some. In fact, there already are some. But I think it's important as we move into the spring season, as we continue to want to process livestock and animals and other food products, that we remove as many barriers as we can to that. And I assure you, the lieutenant governor knows that, and she has made sure that that voice is heard. The other thing that she was going to talk about in regards to communication among all of us, she asked if ISDA is prepared to kind of be a central point, and I assured her that we are. I would say, please communicate with us. That also means communicating, not only with ISDA, but of course with BOA, State Chemist's Office. We've got a number of other entities in the state that will be affected. We are more than happy to be the central point for this information, because she said what her experience was the last several days. There's a lot of information coming from a lot of sources into the governor's office, their team, her office, and her team. And she said, frankly, it in some respects is creating a lot of noise, and they're worried that because of that there will be things that are really important that get missed. So we're more than glad as a department and working with BOA, working with State Chemist Office and others to be that central point, and would ask that you do that. So again, thanks. I apologize we didn't get the lieutenant governor on, but those are her key parts. Just a couple real comments, and we'll open it if there's particular questions. I mentioned communication. One other item I want to say is that as you share those pieces of information with us, please know that no item is too small. It's many times lots of small pieces of information can work together to help pull together and other critical and important pieces that we need. So again, we can be that central point to be able to help with that, and are glad to do so. The other thing that I want to share. One of the reasons I'm really proud to be involved in this industry is in times like this, I find that this industry just continues to be able to shine and show the world what great people we have in this industry. And we're seeing it. I'm witnessing it on a regular basis as I visit with you folks. I want to encourage all of us to remember to continue to be a positive example, whether that's as a business in our community, as a veterinarian, as we're on the farm, as a farmer, as we're working with people in our communities, to be a positive example. I've heard great stories about people helping people. As always, it's nothing new in the ag industry, but in times like these, I think it's even more critical to do so. And what I find is that our industry can communicate and set an example for some sense of normalcy. We know this is not a normal situation, but being able to, because of this critical infrastructure and because of the items like Dr. Marsh has shared, I think it is important to be able to show people that we can do some things, that we're committed to producing food, we're committed to making sure that it's safe, and that we want to provide as much normalcy in these times as we can. And the other thing I will say is let's make sure we're all present in our communities. I mentioned being an example, and I've heard several in the last couple of days of things that are being done by individuals and by companies, and being able to be present and showing examples. I've already heard of a couple of people have shared with me that they're finding ways to employ people that have lost their jobs because of this, whether it be in whether it be workers from restaurants that may be out of job, bus drivers that are probably not going to have much work for the remainder of the year, if any. And again, I think being present like that in your communities and finding ways to be able to help people is just a tremendous, tremendous example. We thank you for doing that and what you're doing for helping us all to get through this. Those are my comments. We're going to open it up for questions here in a little bit. We'll do our best to answer what we can. What I am going to ask is when you ask a question, please state your name and your organization so that we know who is there, and we'll be able to do that. So I'm going to turn it back to the crew at BOA because they'll have control over those things. But again, thank you for what you do. Please know that you can reach out to any of us at any time, and we'll be able to be responsive as we need to. So, Dr. Marsh and team, we'll turn it to you.
Well, thank you very much, Director Kepler. I appreciate your comments. And of course, we have a great collaboration here in Indiana amongst our state and federal agencies. So I appreciate your good work and our ability to continue to collaborate on this specific challenge. If you do have comments or questions, I refer to you, if you're on the webinar, to the chat opportunity. We are receiving some questions that are coming in. We did have one. Dr. Cooper is here. Would you read the first one, please?
Sure thing. So Phil Sager says, what is the protocol in the event an employee of the USDA inspected processing plant is identified as testing positive for COVID-19? Is the plant required to shut down for a specific time period or do normal or enhanced sanitation routines satisfy?
Great question. I suspect it's a question that several have that are in processing facilities. I know that we have received some information from USDA's FSIS that they will continue to provide inspection service, one. And two, I haven't heard specifically on your question about if they have a positive employee, and that's why we pulled from the CDC that if there were personnel in critical infrastructure positions, how they would be managed. Again, I think that document has been primarily prepared for those in the healthcare profession, and also maybe those coming back of passengers and cargo flights, cruise ships, and that sort of thing. So again, we're in collaboration with CDC through the state health department to get a determination on exactly how to manage everyone else, so to speak. There's good instruction on what to do with the positive individual, but less specific on what to do with the other employees. So I'd reiterate and go back to what I had mentioned on the CDC website with regard to personnel in critical infrastructure positions. I cannot make the assumption, but FSIS, I'm sure, is reading the same documents we are, that if you have personnel who are permitted to work following an exposure, should self-monitor under the supervision of their employer's occupational health program, including taking their temperature before each work shift to ensure they remain afebrile. So I suspect certainly we are not aware, and in the BOA side of things, we are continuing inspections in both dairy and our state inspected plants. We will follow the recommendations of the CDC with regard if we should have an employee in the plant. There are no instructions that I'm aware of that plants will close. FDA's website also has information that for plants under their peer review, which would be various food plants, including dairy plants, there's no attempt to close plants, particularly from a food safety standpoint, since there isn't one, but rather from a personnel standpoint, referring back to the CDC guidance. So we're getting clarification on that. And as we gather more, we'll be back in touch. It's a great question, whether it's an FSIS employee, a BOA employee, or one working your plant. The individuals themselves, we have some specifics, but boy, the details for others, I'll be candid, is incomplete at this point. So thank you for the question.
Next question, has anyone heard of ag seed or any seed, ag chem, or vet med supply disruptions?
So I'll turn that to group on the call if there are any particular instances of disruptions of those kinds of supplies.
This is Bruce. I'll take it first and certainly want any other information that we've seen. We have not heard of any at this point. I know I've contacted and have talked to some folks in those areas, not particularly on the vet med side, but we have not heard of any disruptions. I think the concerns that I have heard center around if states put in severe travel restrictions. But again, if we can get to this critical infrastructure piece and get that known and well known, I know a number of states have that in place, and I know a number of others are working on getting that in place. And that should allow those items to be able to move pretty normally. What I can tell you is, again, we have strongly reiterated to the governor's team that the timing this time of the year, make sure that seed, feed, fertilizer, animal feed, anything that has to do with agriculture, particularly on the crop side, of course, because of the nature of getting it done timely, is really important to have that happen right now. And we keep reiterating that on any chance that we get.
Okay, next, someone has asked if we can please update regarding Indiana BOA inspections of food and dairy plants, and if all visits have been suspended, or also they are restricting visitors in plants, but exempting regulatory agencies. So this individual must be in a plant, and Dr. Marsh can speak to our Indiana BOA inspections.
Well, again, thank you for the question. Indeed, we're making every effort to maintain inspection services for all those who need it, whether it's in dairy or meat and poultry. If anyone on the call or otherwise has run into challenges with inspection services, please let us know. We have had extensive discussions with the leadership of our meat and poultry inspection program, as well as the dairy inspection program. And to this point, everything is being covered. There's no attempt to suspend inspections, delay inspections, et cetera. We want to make sure product continues to move. Again, back to this foundation that this is a critical infrastructure of the United States, and that is our approach here. We will maintain inspection services. If adjustments for whatever reason should come down the line, we will certainly be in touch with all the sectors to let them know. If there are prioritizations, triage, if you will, of inspection services, we'll certainly let you know. But we're making every attempt. I'll be honest, I started in meat inspection years ago, and I haven't worked a slaughter plant in a long time, but I can learn how again. So we'll get coverage out there. If you're running into challenges, let us know.
A comment: in the governor's recognition of food production and agriculture as critical infrastructure, renders such as Darling need to be included as part of our industry. They are a very important part.
I appreciate you bringing that up, because indeed the document from Homeland Security with regard to essential critical infrastructure did specifically mention the transportation of deceased carcasses for disposal. Now, that may also include offal from packing plants, certainly, and other pieces of that. But I appreciate the comment, and I know Director Kettler has taken note of that as well as we move forward, that those rendering services are a part of that critical infrastructure.
Another question: as movement restrictions become more severe, will employees and supply trucks need to carry a letter or form attesting to their qualification as a critical infrastructure worker?
This is Bruce Kettler. I can talk to that. We don't know all of those specifics just yet, but I would recommend that at this point, yes, I think whether it's if available employee ID badges, maybe printing off information from these websites that show that. That's one of the things that we're trying to figure out, whether, when we get a state designation, we will ask those questions to find out what is needed and certainly share with everyone. My guidance would be, again, from an abundance of making it very clear. I would recommend finding ways to be able to print off information, have it with the driver, have an employee badge, maybe putting some information on letterhead if you've got it for your company. That way, anything that you can do to clearly identify to any authorities that might be asking what's going on, I think is good.
A comment, a company out of Germany that manufactures aminos have claimed force majeure on their contracts. Another question at this time, is there any thought or encouraging or discouraging human and animal interactions for those of us who are in the business of encouraging and hosting human and animal interaction events for both the short term and long term?
The Board of Animal Health website has a letter that was prepared to speak specifically to, in this case, pets, but as far as animal interactions in general, the restrictions specifically, we had recommended that pets that have been in contact with COVID-19 patients should also remain in the home during that isolation period. But generally, the recommendations as you're around animals of all types, pets, etc., following the same protocol for hand washing, etc., but there's nothing specific that would suggest that these animals either become ill with the virus or are spreaders of the virus.
Bears. That was the context.
Fairs and the context, and of course, we're rapidly approaching that season. I know that we're getting to a point where those conversations are taking place, whether it's county fairs, state fairs, livestock exhibitions of various types. Again, fortunately, we don't know that there is a risk associated with the animals becoming ill or then spreading the virus. I think the greater challenge for us is the commingling of people at these events. In addition to fairs, and I know that's under serious discussion now, depending on how long this challenge is presented to us. We currently have livestock markets that we are, just to reiterate, we're not closing agricultural businesses, but I hope they're recognizing the recommendations of CDC and our governor to restrict large populations of people for the potential transmission of this virus. So I know that's a good discussion that's ongoing with the exhibition community. And extension, I'm in those conversations as well about what to do with 4-H and fairs as we approach that season. So again, as information becomes available, we'll be certainly a conduit to get that to you.
Questions regarding the supply of PPE for ag workers?
We're aware of the questions about having personal protective equipment for agricultural workers. Some of these masks, et cetera, are routinely used for biosecurity purposes in animal and poultry production facilities. We are aware, of course, even at the national level with regard to making sure there's adequate medical supplies for humans. And Director Kettler and I are aware that certain types of those materials are used in the agricultural community as well, and of course in the veterinary community. We're also aware of the President's action to increase production of a number of products, including these kinds of products. If you're running into specific shortage situations, we're happy to receive that information to get a sense of what you need. We're hopeful that this can be turned around at the national level to replenish short supplies. But if you do have a specific need, please let us know. And if we're aware of ways to reroute or where supplies may be available, we're happy to work with you to try and resolve that problem.
We have a question about a ruling for companion animal services, especially regarding urgent care, so emergency services for small animals, companion animals.
In our interpretation, and just so you're aware, this CISA document from U.S. Department of Homeland Security They've indicated in that document that it's an initial list. But again, we have treated veterinary practices as part of the critical infrastructure. We have not teased it out what type of veterinary practice, because those of you in small animal practice are still dealing with public health, with rabies vaccinations, et cetera, or those of you particularly involved in production animal agriculture, of course, are more directly involved in this critical infrastructure. So we're if you're taking those procedures, and I've seen a number of veterinary practices that are doing curbside picks up and these sorts of things in order to reduce the exposures of people within your practices. So if you're continuing to follow those practices, we would encourage those, but as far as curtailing those in any measure, we are not.
How would guidelines and travel restrictions affect people in animal agriculture supply roles? Are they considered essential like veterinarians?
Supply roles. If you refer to the Homeland Security document, and again, we only pulled out just a few of the bullet points on that, and it's a document that's rather lengthy, but on the other hand, under there, under the heading of food and agriculture, you'll see there are probably 15 bullets of what U.S. Department of Homeland Security considers critical infrastructure. Within that, with regard to delivery of supplies, et cetera, it appears to me that it has truck delivery and transport of a myriad of products associated with the food and ag sector. If you have a specific question about a service that you are providing or need, please let us know and we'll take a look at this. But again, if it's in, around, and through, this is intended to be broadly interpreted to support the food and ag sector.
And so support teams to veterinarians, whether it is technicians or animal nutritionists, things like those would also be considered part of the essential function.
That's correct. That's our interpretation of the document.
I don't see anything else coming in via the chat.
Are there other inquiries by phone? Happy to take anything, either by chat or across the phone lines here. We want to make sure that people have their questions answered. Again, this has been very fluid and very dynamic. As we all know, things are changing by the hour. And as a part of the comment, Director Kettler and I are interested to know whether you would like a follow-up call just to keep current on what's going on. I'm particularly interested in feedback from you. This is not intended to be a monologue from the state agencies, but rather to hear from you on those specific things that we might be able to help you with. Not only are we interested, but the governor is interested. The governor has asked specifically of state agencies to identify rules, regulations, statutes, policies, procedures, et cetera, as is happening at the national level, to identify those that may be suspended, postponed, modified in some way by executive order in order to support our critical infrastructure. So if there are particular impediments to your process, Director Kettler and I are very interested to know what they might be.
A comment from Becky Yonishkan at IDEM about please include pumping, transport, and land application of manure in a list of critical activities.
That's an important point, and I saw that in another letter here this morning. It's not specifically named, of course, in the Homeland Security, but again, we would interpret that to be part of the support and function of the food and agriculture sector.
This is Bruce Kettler, and Becky, I can tell you that that specific item has already been put through to the governor's office from our end, particularly relating the importance of being able to make that happen here in the spring to empty lagoon and manure storage and be able to get it done from a plant perspective and also from an environmental perspective.
Several folks are making comments about holding these types of calls or communication regularly.
Very good. Well, that's good feedback. And again, we want to hear from you, not only during these calls, but anytime. As I mentioned, and Director Kettler has mentioned, we're open for business, and we want to make sure this is as seamless as possible. during this pandemic to provide the services you need from us. Again, we're working remotely, we're cleaning surfaces, we're doing all those sorts of things that you're doing in your businesses, but we want to make sure this is as seamless as possible to you. So whether it's today or any time down the line, be sure to reach out to us. We're happy to help. And of course, as this thing evolves, what we're talking about today may be very different by the time of another call, but I appreciate that feedback.
Dr. Marsh, Bruce again. Yesterday, you and I talked at length about a number of things, and you shared something with me that I think might be good for this group to hear, and that is how the difference a little bit of the response and how this has happened at the federal level and to a degree at the state level in terms of the response and some of the items that are being asked to be done of the public and people coming from a public health standpoint. Would you mind kind of sharing with this group? I think that was helpful to me to understand why some restrictions and things are being proposed or thought about. And I think it gives a good perspective. It may be one that's very different for many of us, and also might be one that we can share within our communities as people do respond.
Well, indeed, I think it's important, and many of you on this call over the years know that we have been met with a number of challenges, whether it's disease challenges or food safety challenges or whatever it might be. And I'm always proud of the resiliency of this agriculture and food sector to deal with all these curveballs that come our way from time to time. I think it's also important, as in this particular instance, as we interface with the public health community and their important role in protecting public health of our citizens across the state and country, that we need to keep in mind that interface between the two and their approach to the task, and understanding our approach and necessity to stay open during these critical times. I think it's important that we continue to share the message back through our stakeholders to our public health community, and we have done that here in Indiana, that the critical infrastructure, and that's why I was so grateful for the document coming from USDHS yesterday to identify these critical infrastructures, because our public health partners often are thinking about healthcare systems, physicians, hospitals, nursing homes, et cetera. But there are a number, as is indicated in that document, of critical infrastructures, and they list 16, food and agriculture being one of those. And the management of personnel, therefore, is quite different than you might do if you're dealing with an auto manufacturer, a retailer selling clothing, even our schools. And so the approach is quite different, where in those systems you may choose to close. And that may be, therefore, an appropriate approach there. I think it's important for our partners in public health, as we work with them, to understand that as food and agriculture being one of the critical infrastructures, is finding ways to stay open and finding those solutions and still preserving the public health of our employees and their families when they go home. So it's that interface and trying to strike that balance. We have worked with them in a number of years, whether it's issues in dogs or poultry or calves or whatever it might be over the years. And I think it's important that we find a way to continue this collaboration in a way that's unique, because these systems cannot be simply closed, but rather we need to find a way to keep them open and make sure that we're supporting the infrastructure of the country.
So we have a couple comments regarding critical infrastructure and if Governor Holcomb will be making a statement regarding agriculture being included as critical infrastructure in Indiana.
I don't know that yet. As I said earlier, when I talked to Lieutenant Governor this morning, my ask has continued to be that this be done through executive order or whatever. I've asked that it needs to be made very clear from the governor or governor's office about that. We don't know yet. What I was told was it's very. I was told that the lieutenant governor told me, she said it's close. Now I will be the first to say I don't know what that is. I pressed and didn't get any more than that. But it is my expectation, and what we are sharing with them is that it does need to be mentioned and made very clear and done publicly.
Other comments or questions?
Dr. Marsh, it's Bruce again. If I might make one final comment, and then I'll let you folks close it out. I just want to reiterate the importance of all of us reminding everyone to stay healthy, wash hands, distance, all those things that that are on the websites and that we've all seen and heard. I would also say, as you're in your communities or as you're talking to your employees, some people may question this thought that we, in some respects, are going to stay open for business. But my experience and in talking with some of you has been that a lot of the things that happen in agriculture and all of our sectors of agriculture very often don't involve being around large groups of people. A lot of interactions if you're delivering feed, if you're delivering fertilizer, whatever it might be. Very often, in some cases, you don't have any interaction with people, but if so, it's with small groups. And so if people question you about why maybe you're trying to stay open for business, I think you can remind them that, we still are practicing social distancing. We're doing that, but our folks are really not around, our employees are not around a lot of people in large groups on a normal basis in the effort to do their jobs.
Indeed.
A question about food production on the local level. So direct marketers, farmers markets, online orders, etc. Are they considered critical?
That would be my interpretation of the document, yes.
Yes, I would agree.
I'm sorry.
Go ahead, Dr. Marsh.
No, I'm sorry, but that would be our interpretation in a broad interpretation of the DHS document.
It is our interpretation too, particular to farmers markets and some of those types of industries. In Indiana, we have to remember that the State Department of Health, and in some cases, or with local departments of health, have a lot of responsibility for that. That is not within the State Department of Agriculture, for example. And so we, as a department, in fact, for about a week now, have been working to make sure that we get with the appropriate people at State Department of Health to be able to allow those things. I know I've had a number of communications from farmers market individuals about some restrictions that those groups have already put forth that they will abide by to make this happen. We are reiterating that local foods and people that are doing this can be an important cog of providing food locally to people. And so we continue to make that happen. Just know and understand in Indiana that it's not as simple as us in the Department of Agriculture being able to say this is what we're going to do.
We have another question about feed stores, including Rural Kings and Tractor Supplies, and whether or not they will stay open. I know personally I've received emails from Tractor Supply, and they've revised some hours, but they've also increased their inventories, they say, or they're attempting to. So as of yesterday, they didn't have an intent to close, and so I think that would probably be case by case basis, and we would encourage calling those stores directly or visiting their websites. And yes, for the folks who have asked, a copy of these slides as well as the recording will be provided on BOA's website. Another question, can we get a copy of the permission slip that we should give our dairy employees so that they have authorization to travel without being afraid to face fines? I think this was maybe similar to a previous question about whether documentation is going to be needed for travel. I think Director Kettler addressed that earlier.
I would say we don't know the specifics yet. It would be our intention if we think that's what we have to have. Yes, we'll make it widely available, and I would probably the easiest way to get it to a number of folks for those that are able to get it off of a website and that we will share that as best we can, and if we need to get it for other means. I want to reiterate, we don't know right now whether we need that. My comments earlier were I think out of caution, I would find this information is on these websites. I think it's fine to print it again, maybe put it on letterhead if you have it. Make sure that your employees, if they have things like ID badges or whatever the business might require, I think making sure that they have those with them at all times would be helpful. We want to make sure that we cooperate and not create more issues with local authorities.
Any other comments or questions? These are really, really helpful to us as we continue to plan and prepare. I don't want to cut it short. Well, very good. I appreciate very much everyone participating today. Again, a lot of information is evolving very, very quickly. Director Kettler and I and his team will be in touch. And Director Kettler, I don't want to put you on the spot, but if we were ask people to kind of hold this noon Friday, is that okay with you? I apologize, we didn't check on this in advance.
You're fine, not a problem. I suspect, like most of us on the call, we're going to be dealing with this for a call. I think at this stage, I am perfectly fine with that. I don't know why we wouldn't. It appears based upon what I'm seeing on the chat that people want to have this. Again, I said from the beginning, I think communication among all of us is key. I'm perfectly fine with doing that, and we'll let people know.
Very good. Well, for those of you on the call then, we'll hold this time slot at noon Eastern next Friday, and that date will be the 27th, I believe. So next Friday at noon, and of course, we won't have all the, unless there are significant changes in these documents, you'll have already had the foundation from this week, so we can move more quickly to issues that you're dealing with in your local communities. And again, I appreciate all of your participation today. Any last thoughts or comments from the group before we close? Well, Director Kettler, my thanks to you, and please extend my apologies to the Lieutenant Governor. Since we've scheduled a call for next week, we'll try to get her patched in next week, if not sooner. But my thanks to you and your team. My personal thanks to my team here at the Board of Animal Health, and therefore extend that thanks to all of you in the ag sector through our state. Thanks for all you do. And again, let us know if we can help in any way. Enjoy the weekend.